Welcome to YARKUD International. In this section, let's discuss the Saudi Prometric examination important question and answer. So one by one, first question, which of the following action, if performed by the nurse, would be considered negligent? Okay, this is the question. So what is negligent? If you know what is negligent, you can able to find out the answer. So what is the negligence? It is the failure to exercise the appropriate care. Okay, nurse should be do this one, but because of carelessness, she didn't do, so it will be harm to the patient. Got the point? This is called negligence. Just understand this. So let's move on. Allowing a 10-year-old with juvenile rheumatoid arthritis to ride a bicycle. Okay, so that will be the first option. 10 years old, so juvenile rheumatoid arthritis to ride the bicycle. So they need some amount of exercise, right? So it is not the negligent. Got the point? Okay, it is not allowing to ride the bicycle only. It will be normal only. No need to consider as a careless act. Okay. So second, massaging lotion on the abdomen of a 60 years old diagnosed with the abdominal aortic aneurysm. What is aortic aneurysm? It will be the ballooning of the veins and arteries will be ballooning. There is the aortic, there is an aneurysm called abdominal. There will be the bulging of the vein. So there is any time there is a chance of the rupture. Okay, here, what they are doing, massaging lotion in the abdominal. 60 years old. Okay, so very high risk. Already there's elderly 60 years old and there is abdominal aortic aneurysm. If you just massage in the abdomen, there is high chance of there is a bleeding. Okay, there is a rupture happen inside the abdomen. So this one will be considered as a negligence. Let's see the next one. Instructing a 5 years old asthmatic to blow bubbles. Okay, if you see instructing 5 years old, yes, asthmatic patient blowing bubbles, it is good to exercise for the lungs. Okay, that is correct only. Obtaining a Guthrie blood test on a 4-day-old infant. Okay, that is also, it will be correct. So you have to be read 4 option. If you just find out the answer, don't skip another options. Okay, because sometimes there is a 2 option will be very correct. In that most important thing, you have to be most best answer you have to select. Got the point? So here the answer is what? Massaging lotion on the abdomen of a 60 years old diagnosed with abdominal aortic aneurysm because there is a high chance of rupture. Already patient is high risk because 60 years old. Got the point? Okay, this is the answer. Likewise, you have to be select the answer. Okay, we'll move on to the next question. Planning is the category of nursing behavior in which, okay, this is about the nursing process question. We have the assessment, planning, and there is a implementation, evaluation, right? So this type they are asking, if it is planning means what is the category of nursing behavior in which? Okay, let's see. You can be able to understand easily. See, the nurse determine the healthcare needed for the client. Okay, nurse is determining first one. Second one, the physician determine the plan of a care of the client. Okay, and third one is client-centered goals and expected outcome are established. Okay, D is the client determines the care needed. Okay, so think about that. If it is only nurse is determining the healthcare needed for the client while planning, no, it is only physician determine the plan of care. No, it will be only the client determine the care, plan of care. No, A, B, D is, it is depending of only one person, not like that. It is client center, whatever the client needed. Okay, client centered goals are expected outcome are established. Okay, while this type of question you can easily just think about and write it off, it will be easily find out. Okay, so client centered goals and expected outcome are established. Got the point? This is called plan. Okay, C, option C is the answer. Let's see the next question. The nurse assess a prolonged late deceleration of the fetal heart rate while the client is receiving oxytocin. That means Pitocin injection, okay? IV to stimulate labor. The priority nursing intervention would be true. Okay, this is many type of question. Okay, many situation they have given like this. Okay, Pitocin is ongoing. Okay, so there is a prolonged deceleration of fetal heart rate is happening. So what you have to remember, there is a fetal distress is happening now. So we are just giving Pitocin to stimulate the patient uterus. So it will further hurt the baby, further the patient, the fetal heart rate will be, fetal will be distressed. Okay. So what you have to do, then after infusion or turn the client to the left side or change the fluid to wrinkle lactate or increase maintain IV, mainline IV. No, you have to be immediately turn off the infusion because this infusion will call further uterine contraction that will be more hurt the baby. Okay, fetal will be more hurt, fetal distress will be increased. So immediately if the fetal heart rate is deceleration, acceleration, there will be the changes. Immediately you have to look for the whether the patient is going on to the mother is getting Pitocin. You have to stop. Okay, turn off the infusion. Got the point? This is from the maternity question. Let's see the next one. A patient admitted to the mental health unit for treatment of psychotic behaviors spends hours at the locked exit room shouting, "Let me out. There is nothing wrong with me. I don't belong here." What defense mechanism is that patient implementing? Okay, this is about the defense mechanism. We have just seen, okay, so many defense mechanisms we have, the denial, projection, regression, rationalization. Okay, so there is so many. So here you can easily find out patient done something. Okay, mental, there is a admitted for the mental health unit for the psychotic behavior on. Okay, so many hours the patient is locked inside the room. Okay, so exit door, there is a patient is already 1 hour. Okay, so many spends hours in the locked. Then the patient thinks and patient is telling, shouting, what shouting? "Let me out. There is nothing wrong with me. I don't belong here." That means whatever he did, okay, he's refusing. That means denial. Okay, denying that I don't need to be here. I didn't do anything like that. Okay, so I don't belong here. He's refusing. So it is come under the called defense mechanism called denial. Okay, sometimes it will be applicable not only the patient. Sometimes the nurse also they will be giving. So some doing something wrong and just seeing the senior person just telling, "I didn't do that." Okay, that is a denial act. It will be come out as a defense mechanism. Got the point? Okay. So it will be applicable for the patient side also and the staff nurse side also. So any situation question come, can able to answer it. So the answer is denial. Got the point? Okay, let's see. This is from the mental health. Next question, let's see. It is from the medical. Okay. A male client with type 1 diabetes mellitus asked the nurse about taking an oral anti-diabetic agent. Okay. Nurse Jack explained that this medication are only effective if the client. Okay. Male patient diagnosed with type 1 and taking, okay, nurse asking the nurse, "Can I take the oral anti-diabetic agent?" Then the nurse Jack is explaining this medication. That means a oral anti-diabetic agent. It is effective for which client? They are asking that on. Okay. So prefer to take options are preferred to take insulin orally. They didn't ask what is preferred to take for the Jack is not explaining. You just take this one. Okay. So not preferred to take. This answer is won't come. Okay. Insulin oral. Has type 2 diabetic, has type 1 diabetic, is pregnant and type 2 diabetics. Okay. This is the answer. So now let me see here. There is a type 1, type 2 diabetes we have no. Okay. What is type 1 diabetic mellitus? It is insulin dependent diabetic mellitus. Okay. What is type 2? It is non-insulin dependent diabetic mellitus. So type 1 diabetic, we will give insulin. Type 2 diabetes, we will give oral hypoglycemic agent. Have you remember oral hypoglycemic agent? So that is called only oral anti-diabetic agent. Got the point? So this is the, now patient is type 1 diabetic mellitus. So they should take what? Type 1 diabetic mellitus, there is needed insulin only, but the patient is going to take oral anti-diabetic agents. So nurse Jack is telling the anti-diabetic agents are effective for which patient? Type, there will be the patient with the type 2 diabetic mellitus. Got the point? It's not about the pregnant and type 2 diabetes. Okay, so you don't need to confuse that. So it will be effective for the type 2 diabetes. If it is only pregnant, it will not effective. It is all the type 2 diabetic patient, oral anti-diabetic agent effective. Type 1 treatment, type 1 diabetic mellitus, it is insulin. Okay, read the question carefully and answer. To confuse you, there will be the true, utterly, mostly, there will be the true answers are same. You should be, use your critical thinking and answer the question. Okay, so here the answer is, so B and D will be confused, but D is pregnant, if pregnant. No, not only pregnant, all the patient has type 2 diabetic mellitus, the oral anti-diabetic agent is effective. So you have to be right, the answer is B. Got the point? So these are the many topics Prometric exam, Saudi question and answer. Here the YARKUD International, we are giving the online training for the all the nursing examination like Prometric, SNP, MOH, Omen Pearson View Nursing Examination, THA, HAD, OAT and IELTS.